Make sure to read the medication guide and patient information leaflet provided by your pharmacist before starting apixaban. Take this medication by mouth with or without food as directed by your doctor, usually twice daily. If you cannot swallow the tablet whole, you may crush it and mix with water, apple juice, or applesauce. The dosage is based on your medical condition, age, weight, kidney function, response to treatment, and other medications you may be taking. Be sure to tell your doctor and pharmacist about all the products you use. If you are taking apixaban to prevent blood clots after surgery, the length of treatment is based on the type of surgery that you had. Do not stop taking this medication without consulting your doctor, and be sure to order your refills early to avoid running out of pills. Use this medication regularly at the same times each day to get the most benefit from it. If you experience nausea, easy bruising, or minor bleeding such as nosebleeds or bleeding from cuts, it's important to tell your doctor or pharmacist right away. This medication has been prescribed because the benefit to you is greater than the risk of side effects. However, it's important to be aware of potential serious side effects, such as unusual tiredness, prolonged bleeding from cuts or gums, or difficulty swallowing. If you experience any signs of serious bleeding, it's crucial to seek medical help immediately. Additionally, while rare, a serious allergic reaction to this drug is possible. If you notice any symptoms of a serious allergic reaction, such as rash, swelling, or trouble breathing, it's important to get medical help right away. Be sure to contact your doctor or pharmacist if you notice any other effects not listed. Before starting with Eliquis, it's important to let your doctor know if you have any allergies or if you have a history of liver or kidney disease, bleeding problems, blood disorders, recent major injury or surgery, stroke, or any clotting disorder. It's also important to inform your doctor if you are planning to have surgery or any medical/dental procedures, as they may advise you to stop taking Eliquis temporarily. It's important to be cautious with alcohol while taking this medication, as it may increase the risk of stomach bleeding. Limiting alcoholic beverages is recommended. Additionally, Eliquis may cause heavy bleeding, so it's important to be careful with sharp objects and to avoid activities that may lead to injury. Using an electric razor for shaving and a soft toothbrush for brushing your teeth is advised. If you are pregnant, Eliquis should only be used if clearly needed, and it's important to discuss the risks and benefits with your doctor. It's also unknown if this medication passes into breast milk, so it's recommended to consult your doctor before breastfeeding while using this medication. It's important to be aware of any potential drug interactions with Eliquis. Before taking this medication, make sure to inform your doctor and pharmacist about all the products you use, including prescription and non-prescription drugs, as well as herbal products. Some products that may interact with Eliquis include mifepristone, other drugs that can cause bleeding/bruising, certain antidepressants, and other medications that can affect the removal of Eliquis from your body. Additionally, aspirin can increase the risk of bleeding when used with Eliquis. However, if your doctor has directed you to take low-dose aspirin for heart attack or stroke prevention, you should continue taking it unless instructed otherwise. Always consult your doctor or pharmacist for more details on potential interactions and the best course of action for your specific situation. If you or someone you know has taken too much of this medication and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Symptoms of an overdose may include bloody or black stools, pink or dark urine, and unusual or prolonged bleeding. It's important to note that you should not share this medication with others. Your doctor may also conduct lab or medical tests, such as hematocrit/hemoglobin and red blood cell count, while you are taking this medication. It's important to keep all medical and lab appointments and consult your doctor for more details. If you forget to take a dose, take it when you remember. If it's close to the time for your next dose, skip the missed one and take the next dose at your regular time. Don't take a double dose to make up for the missed one. It's important to store Eliquis at room temperature, away from light and moisture. Make sure not to store it in the bathroom. If you need to crush the tablet and mix it with water, apple juice, or applesauce, use the mixture within 4 hours. Keep all medications out of reach of children and pets. When it comes to discarding the medication, do not flush it down the toilet or pour it into a drain unless instructed to do so. Make sure to properly discard the product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.